Hi, I'm Natalie. I'm founder of the Feeding Trust. We're the only UK charity who support children with paediatric feeding disorders and developmental feeding differences.
Hi, I'm Jess, and I'm from the Spectrum and Me and also Neurodiversity, and our page is Oliver's Autism Journey.
Hi, I'm Michelle. I'm the founder of Nigel Foundation. Today we're here with Natalie from the Feeding Trust to discuss feeding differences.
Hi, I'm Sue. I'm part of the Nigel Foundation and I'm here today to help out with the interview. To help our audience understand paediatric feeding disorders, can you tell us what PFD is?
So PFD, or paediatric feeding disorders, are it's kind of, we would describe it as a unifying diagnosis because it really helps people to understand how complex feeding difficulties can be in children, because it classifies and organises feeding difficulties, if you like, according to 4 key domains, and they are medical, nutritional, skill-based, and psychosocial. Basically, all that means is we recognise that there are lots of different medical conditions that can really interrupt the feeding process, if you like, in children when they're learning to eat and drink, and that impacts on their skills. So when they have these medical problems, the children kind of don't tend to follow a typical feeding trajectory because the medical is getting in the way. That then has nutritional consequences, so it impacts on what they're able to eat, how often they're able to eat, whether or not they can keep their food down, their growth, obviously. And then that has an impact. The psychosocial, basically, kind of, that means the almost like all the environmental stuff and all the family stuff and all the social stuff. And how, when you've got a child with feeding difficulties and differences, it's really, really difficult. And the social and emotional impact is huge, and the stress that's caused for the whole family really then impacts on the whole feeding dynamic.
Common signs and symptoms of PFD that parents should watch out for.
I think one of the difficult things about PFD is it's quite broad, and actually it will look very different depending on the age of the child and kind of what's causing it, if you like. So you can have a very, very young child who's maybe only sort of 3 or 4 months old, that actually they've got, you'll see crying, you'll see arching, you'll see sweating, you'll see grimacing, you'll see turning away from the bottle sort of thing. But with the older the children get, you see different sort of changes in how they will present. So obviously, a common thing that you'll see is that children really, really struggle with progressing through sort of from breast or bottle feeding through to weaning and texture progression. And you often really see problems when they are kind of going from sort of like that puree through the lumpy stage into the finger foods. And what parents will see is you'll see lots of pushing away, you'll see lots of crying, you'll see difficulties managing different sorts of textures, different sorts of foods, you'll see gagging, you'll see vomiting, all of those sorts of things
so
are really, really common.
Parents might notice that if they put, I don't know, some crisps in front of them, some soft crisps, and then some like spaghetti, that the child might be like, well, I don't mind that texture, but
I can't manage that one, absolutely. So you'll often see lots of throwing of food, and all kids go through a stage of kind of throwing stuff off, but there's that's just kind of like a little phase they'll go through, and they'll often have a go at trying things. But you'll see with kids with PFD, they absolutely won't have a go. They will really, they won't even touch it. But I think one of the big things that you see is that actually parents then spend an awful lot of time trying to sort of find things that their child does like. So meal times end up taking longer, and you have to make quite a lot of changes and adaptations to kind of support your child with their feeding, because otherwise you're really worried that they're not going to grow.
It makes you stressed as a parent as well, doesn't it?
How does feeding challenges affect a child's growth, cognitive development and social skills?
That's a really good question, actually, Sue, because I think one of the big things that people almost forget is that feeding is a developmental skill like any other. So just like children will learn to walk and learn to talk at different rates and in different ways, children will learn to eat at different rates and in different ways. And it doesn't always go exactly as you might expect, and it's really interesting, because whereas if your child has got difficulties with learning to talk, for example, so if they get to kind of 3 years old and they're not saying anything and you go to the doctors, they'll go, okay, cool, yeah, of course, let's refer you to speech and language therapy. Or if they get to 2 years old and they're not walking, I'll say, oh right, okay, yeah, let's refer you to physio. What they wouldn't turn around and say, well, your child's just fussy and awkward, try harder. Which is what parents get when they take their child with feeding differences to the doctors. And what happens then is, of course, you get a child who actually is really, really struggling with their eating, and that can really impact right from the word go, because actually a whole lot of people's time is taken up with trying to get their child to eat. And actually, that's lost time when they're not playing and they're not exploring the world around them. You know, they're really these kids are so dysregulated that actually that impacts other aspects of life. And some of our children, they can't go into nursery, they struggle getting into school, they can't go to children's parties because the eating issue is such a significant challenge. So all of those learning experiences, all of those social experiences are kind of impacted because of their eating.
It's really tricky, I suppose, isn't it?
It's really, it has a really, really big impact outside what people think is. People think it's just about weight and about growth, and one of the big problems is, again, because parents spend such a lot of their time trying to make sure that their child actually gets some nutrition inside them and they grow. When they go to the doctors pop them on the scale and go, well, they look all right to me, they're growing okay, there's nothing to see here. And that's a really, really big misconception about paediatric feeding disorders and, you know, children's developmental feeding differences. They don't have to be underweight to have feeding differences and difficulties.
I suppose as well, it's all the nutrients, isn't it, as
Massively.
they grow. So from a child, it's got like a fertiliser, isn't it? So when they get to adult
that's a
life,
really nice analogy.
You know,
I like that.
to adult life, there's strong bones, isn't it, and their immune system. So it's a whole.
But there is,
spectrum.
you know,
it's not just food as such, but it's for the future.
It is for the future, and you don't want to scaremonger, but actually we know that children with paediatric feeding differences, they prefer predictable foods, and those predictable foods are often those sort of ultra-processed foods. And you know, there's a lot of stuff, isn't there, out now that actually we know that we shouldn't be adding too much of those ultra-processed foods, because in the long term, they're the ones that they're now thinking, well, is that linked to heart disease? Is it linked to diabetes? And you're like, you've got all that pressure on you as a parent hanging over as well. So it's really hard.
It's tricky, definitely it is. Can you give us some examples on myths or misunderstandings about picky eating and the realities of paediatric feeding disorders?
Okay, so the first thing I'm going to jump on with that question is the picky eating thing, because actually, you know, picky eating is a normal part of child development, and most kids will go through a phase of picky eating, and that's when, like, you give them their biscuit and they're like, I don't want that, it's got a brown bit on, or they won't eat the broken biscuit and they want a brand new one. And it's, you know, most kids go through it, and they will just kind of pass through it as part of their typical child development. Paediatric feeding disorders and what I would call developmental feeding differences that are often associated with children with all sorts of different neurotypes are very, very different from picky eating, and they are an absolute world apart. And as a result, that you know, you see a lot of myths and misconceptions, misinformation, I'd kind of call it now in the modern term, about, you know, just do this, just do that, and they'll be fine because it's just a phase they're going through. It absolutely isn't just a phase they're going through. And one of the things that we often come across is that classic of, well, if you just leave them when they're hungry enough, they will eat. And you'll have heard that one a lot, and that's one a lot of our parents come to us and say, and we've had some really, really, you know, horrible situations where, you know, paediatricians, you know, have said to these families, just don't give that child their bottle or what have it is, and 3 days later they're in, you know, A&E on a drip because they haven't just miraculously just started eating. Because why would you choose? Why would you choose to just not eat at the age, at the age of 6 months, 12 months, 18 months, 2 years? Children are responding to something that feels different in their body. Something does not feel right. It's painful, it's uncomfortable, it doesn't feel right. It's difficult, I can't do it. And if they could do it, well, of course they would. It's the easier thing to do it. So actually our children with paediatric feeding disorders and differences will not just magically do it because it's hard. It's painful, and what we need to do as the adults around them is actually look at how can we adapt things, how can we support things, how can we actually make them kind of feel safe in that environment, with that food, with the relationships, and that feeling of felt safety is so critical for our children. And you will not make any progress until children have that feeling inside, and just withholding food is going to do the polar opposite.
Definitely, it's make it more of a bigger issue.
You make it a bigger issue. You put the pressure on. It's that expectation. You've got to do this, and of course, the second you put that pressure and that expectation on, you're moving into kind of like coercion, and that's like I say. How safe do you feel if you feel like you're being forced to do this? And
I suppose that would make it feel like more of an issue then, and push the child back even more 100%. Because you're essentially, like you said, trying to force them to do something they don't want to do.
Exactly that.
Rather than encourage them to maybe put like a few different things down and let them have the choice.
Have a go
and try.
And just try and it's that kind of what we kind of call exposure without expectation. And it's that real lovely kind of like collaboration and working together in a really nice, relaxed way. But how do you do that as a parent if you've got paediatricians saying just make them do it? And then of course as a parent you realise then that actually that hasn't worked and actually it's made the situation worse. Oh my God, the guilt you then feel as a parent. You just think, well, what have I done? I've made that situation worse. And it's like and parents then feel to blame, and parents have so much pressure on them put by, unfortunately, medical professionals often kind of reinforcing that misinformation and actually making the situation worse. And parents have to feel regulated. They have to feel that they are, that their concerns are being listened to. Yeah. They are valid, they're valid, real concerns. Because until parents are properly listened to and they feel well regulated, they can't support their child to feel regulated as well, because that whole system of co-regulation with feeding is core. It really is core.
How can families find support both professionally and within their community?
So I think the community aspect is an easier one to start with, because friends are really important when you've got a child with paediatric feeding differences. Friends who understand, and we kind of talked a little bit about co-regulation, and actually as parents, co-regulating with your friends and your community is a really good way to actually help you be able to take on some of the challenges, because it is a challenge trying to find professional support. That's one of the reasons we set the charity up. Well, it's not just one of the reasons, it's probably the key reason, because there is so little recognition of not just paediatric feeding disorders but developmental feeding differences and how common they are in children with medical, developmental and learning differences. So we know that 80%, there's kind of like, probably up to about 80% of children with medical, developmental and learning differences will experience feeding challenges and feeding differences. And mostly because of their medical, developmental and learning differences, people just kind of go, oh, that's just part of that. Right. So it's kind of, oh, that's just autistic eating.
Okay.
And so we'll just leave it. But, if you had an autistic child who had no form of communication, was really dysregulated and was stood in a corner screaming because they had no way of communicating with the world around them, would you just say, oh well, that's just the way they are, we'll just leave it to it?
No.
You would find a way. Yeah. You would find a way to support that child, wouldn't you?
Yes, definitely.
You know, you go to speech and language, and they might say, well, let's do this, but you would adapt that environment around them to actually help them. Yeah. And why don't we do that with feeding? Why do we just say, well, just carry on, just keep trying? Why do we not say, well, maybe we need to do something differently? If they've not learnt it this way, if their learning style is different, maybe we need to change the way that we're helping them learn. Maybe we need to change the environment. But that doesn't happen. And so much of that sort of support from professionals needs to be actually just recognising that we might need to do things in a different way, and that's okay. And that's really, really important.
And not rely on what might have worked 10 years ago. Do you think the government need to put in extra training for GPs and other medical professionals to help them understand it more?
Absolutely. The difficulty is, I think we certainly feel as a charity that sort of early feeding differences, which I said are very, very much part of typical development for children with different neurotypes and different sorts of development, it becomes really medicalised really early on, and it becomes a medical problem. Therefore, you have to go to a medical professional, and it all becomes very much about kind of, well, are they at risk or aren't they at risk? Oh, well, actually, their growth's okay, so they're not at risk, so off you go. And you're like... So if you kind of shift the lens and say, well, this isn't a medical problem, this is just a different learning style, this is a developmental thing. Actually, what we're looking at here is we're looking at health, we're looking at education, we're looking at the social care. And this is part of the problem, because it's no one person's responsibility. And if it's no one person's responsibility, everyone just passes the buck.
How can early intervention and therapy help make a positive change?
Well, I would kind of almost refer it back to what we said about sort of speech and language therapy earlier on. You know, we don't just leave a child to kind of try and work out how to communicate themselves, because you know that actually if you just leave it, the gap between them and the rest of their peers and all the other learning opportunities they've got just gets bigger and bigger and bigger. And actually what you're doing by not providing any support early on is you're actually disabling them for the future. And it's exactly the same with developmental feeding differences. If we just leave it and if we ignore it and just kind of hope that either they'll just miraculously learn it, or just accept that they can just eat Wotsits and live off Wotsits for the rest of their life, we are creating a much bigger problem down the line. And we know a lot of our children with early paediatric feeding differences, either they'll get those kind of health, sort of physical health problems further down the line, as you said. You know, we've seen things in the news about, there was a teenage lad who he went blind. He lost his sight due to vitamin deficiency because his feeding difficulties from early on had just been ignored. And you've had the tragic case. You have had tragic cases of children dying. Now those are extreme, but actually, we've got those really obvious physical health problems, but we also know that if you don't support, as children get older and as their kind of their identities grow and their belief systems grow, what starts off as a very sort of physical problem actually kind of turns into more of a mental health problem, and then you have an eating disorder. And we know the impact of eating disorders, and they're lifelong conditions as well. So you then have this combination of an underlying physical problem, skill-based difficulty that turns into a mental health problem. So it's really key to help as early as possible.
Brilliant, thank you.